Good morning. So it is a pleasure to share with you the new nuances of drug-eluting balloons or drug-coated balloons, whatever you call it. And basically, why it is so important, because stents, we have seen that they have problems like stent thrombosis, late stent thrombosis, late restenosis, very late restenosis, and all these things are real. We know from the data which is available up to 10 years or more than that, that these problems do exist, and also the vasomotion of the arteries is also one of the issues. So, what are the options today? So, the options which were developing for few years in the past was the drug coated balloons, but now the technology of drug coated balloons has actually improved, and we see that now the promise of delivering the drug at the site has become much more reliable, and also the amount of drug which reaches the artery is also predictable. So, with this approach, we can now treat many patients, either they are in-stent restenosis or they are de novo lesions. And among the de novo lesions, we have predominantly, what we were traditionally treating was small vessels, diffuse disease, diabetic patients, and also sometimes side branches of the arteries where the main vessel was being stented. So, with this approach, we were progressing well, and now we have even started taking up proximal lesions, ostial lesions, especially in young patients. When there is a ostial LAD lesion or a circumflex lesion, we can do a cutting balloon or any other kind of a debulking therapy followed by a drug coated balloon. And especially if we use paclitaxel eluting balloons, they have been found to be better in the recent trials compared to the sirolimus eluting balloons. However, as a technology, the drug coated balloon is really showing good promise for a large subset of patients, and patients also feel happy that they don't have any stent inside, there is nothing left inside, and the positive remodeling of these vessels which we see angiographically is also quite interesting, quite prominent, and we are also interested in positive remodeling of these arteries. So I think today, in today's situation, we can use drug coated balloons, especially paclitaxel eluting balloons, especially the newer iterations of drug coated balloons where the promise of drug delivery is better. We can certainly use for these kind of indications, and many young patients can be done by a stentless angioplasty. And also sometimes we can even do a hybrid treatment where we put a small stent somewhere and then the rest of the long lesion is treated by drug coated balloons. And of course, the knowledge and the experience of seeing that even type A, B dissections, even up to C dissections heal up, they heal up very well, they do not lead to untowards outcome in most circumstances. So with this, I am very sure that if we choose our patient rightly, if we treat them rightly, if we do a good debulking procedure, do a good angioplasty followed by drug coated balloon, I think we are definitely heading towards better outcomes in these complex patients. Thank you.